Hi everyone. Our focus for today is artificial intelligence in radiology. When you think about radiology, it's just looking at medical images and trying to find what's wrong, but it's not always as easy as it sounds or what people tell you. Sometimes things are very small or not obvious, and that's where artificial intelligence comes in to help. Imaging like X-rays, CT scans, and MRIs let doctors see inside the body. These images can be very detailed, and sometimes a really small change can mean something very serious. If something gets missed, it can delay treatment, so getting it right is very important. So, because of that, AI systems are trained using many medical images. As they learn from those images, they start to recognize patterns and point out anything that look unusual. In an article focused on fracture detection using artificial intelligence, it showed how this can help doctors find fractures more easily, especially in busy places where a lot of images are being looked at. If you look at the slide, you will notice some areas are being highlighted, but also labels like normal, fracture, and effusion, along with different level of suspicion. That part really caught my attention because it's not just pointing at the image, it's also giving a kind of summary of what might be going on. In the fracture example, you can see that the system shows a higher level of suspicion around the injured area, which makes it easier to focus on that spot. It feels like having extra guidance while looking at the image, especially when the fracture is not very obvious at first. And it's not just used for fractures. In another article about AI in diagnostic radiology for neurological condition, it explained how these tools can help detect things like bleeding in the brain, which can be easy to miss without support. This is also used in mammograph to help find early signs of breast cancer. A study on AI for breast cancer detection showed how it can support early screening and improve how well problems are found, which can really make a difference for patients. Yeah. Another important benefit is speed. Images can be looked through faster and urgent cases can be picked up earlier. There's also work on assistive AI in radiology reporting that shows how it helps organize reports and make the whole process smoother and easier. Even with all this, radiologists are still very important. We shouldn't forget that. In research comparing AI with human experts in MRI interpretation, it showed that doctors are still needed to make the final decision. AI helps, but it does not replace them. Of course, there are still some challenges like the cost of technology, concerns about keeping patient information safe, and the need for training before it can be used safely. But at the end of the day, AI is helping make radiology faster and better at finding problems while still working together with doctors to improve care. Thank you. I hope you guys understand from what I just said about artificial intelligence in radiology.